Lung cancer is the leading cause of cancer death, and there are 5 different forms of lung cancer that you should be familiar with. Small or old cell lung carcinoma and squamous cell carcinoma are strongly associated with smoking. And these forms of cancer, their location is in the central lungs. Versus adenocarcinoma, which is the most common cancer of non-smokers. And it's in the periphery, as well as large cell, which is also in the periphery of the lungs. So if here we have the right lung, and then we have the left lung, the small and squamous cell are in the center of the lungs, which would be here, and then the large cell and adenocarcinoma would be in the periphery of the lungs. Now back to the topic. On the histology of small cells, you will see poorly differentiated neuroendocrine cells, also known as Kolchitsky cells. And then they are in the center, and this form of cancer, as I mentioned earlier, is strongly associated with smoking. Additional symptoms that may be present in these patients include paraneoplastic syndrome, where these patients may present with Cushing syndrome due to the increased secretion of the ACTH. They may present with the syndrome of inappropriate antidiuretic hormone due to the increased secretion of ADH, and they may also present with the Lambert-Eaton's syndrome, where these patients are presenting with weakness that improves with repetitive activity. The next condition is squamous cell carcinoma, and on the histology you will see squamous pearls, which is shown right here. In addition, you will see desmosomes in between cells or intercellular bridges. So if you have one cell here with the nucleus in the center, and then another cell right here with the nucleus in the center, you will see on the histology a small bridge between the two cells, and this is called intercellular bridges or desmosomes. This condition, squamous cell carcinoma, is associated with the hyperparathyroidism due to the secretion of the parathyroid hormone-related peptide, and thus these patients present with hypercalcemia and hypophosphatemia. Next, we have adenocarcinoma of the lungs, which has the lowest association with smoking, and on histology you will see mucin and glands. And this type of cancer is associated with KRAS mutations. And I should have mentioned earlier that small cell lung carcinoma is associated with mutations in the L-MYC oncogene. The next form of cancer is large cell carcinoma, where on histology you will see poorly differentiated large cells. And then finally we have the carcinoid tumor of the lungs, which presents on histology with well differentiated neuroendocrine cells. And then it presents with a polyp-like mass in the bronchus. For the diagnosis of carcinoid tumors of the lungs, you can check stain for the chromogranin. And then these patients are also associated with carcinoid syndrome due to the secretion of serotonin. And features of carcinoid syndrome include, for instance, abdominal pain, diarrhea, cutaneous flushing, asthmatic wheezing, as well as right-sided heart murmur. So next we can go over the complications that may arise from lung cancer. So lung cancers can spread to local lymph nodes and then later on cause metastasis. So local lymph nodes, for instance, include hilar, mediastinal, tracheal, as well as bronchial lymph nodes, and then they can cause metastasis to the adrenal glands, brain, bone, as well as the liver. It can also cause the SVC syndrome due to the obstruction of the superior vena cava, as a consequence of which blood and the fluids will back up in the upper extremities, and thus these patients present with the facial and arm edema, as well as jugular venous distension. These patients may also present with phrenic nerve palsy, as a consequence of which they present with the hemidiaphragmatic diaphragmatic paralysis. So phrenic nerve is the nerve that innervates the diaphragm, and there are two phrenic nerves, one on the right side, one on the left side. So if one of them stops working, then these patients present with hemidiaphragmatic paralysis. These patients may also present with the recurrent laryngeal nerve symptoms, which presents with the hoarseness of voice. And finally, tumors that are in the superior sulcus can cause compression of the cervical sympathetic plexus, as a consequence of which these patients can present with Horner's syndrome, which presents with the PAM symptoms. And the mnemonic that you have is that PAM is horny. So PAM stands for ptosis of the eyelid, presents for anhydrosis, as well as the meiosis of the pupils. So these are the symptoms that can present with the Horner syndrome. And then for the treatment of these patients, it depends on what type of lung carcinoma they have. If they have a small cell lung carcinoma, then usually you have to treat them with chemotherapy, for instance with cisplatin. And then if they have non-small cell lung carcinoma, then you should be treating them with surgery. And radiation is a treatment that can be added as an adjunct to these therapies. Now, the reason that patients with small cell carcinoma cannot undergo surgery is that the location of these forms of tumor is usually in a place that is hard to resect, and thus they must be treated with chemotherapy rather than surgery. And the memory aid that I have for you to remember that small cell carcinoma is not being treated by surgery is that these forms of tumors are so small that you cannot resect them. So small cell carcinoma, you cannot resect them, so you will have to treat them with chemotherapy. And that concludes our discussion.